Thank you to Alexis and Chris for joining today's episode of AI Outcomes. And we're covering possibly the most important topic, which is healthcare today. So before I go for the agenda, maybe we'll do some intros. Maybe Alexis, do you want to go first as you set this up for
Yeah,
us?
yeah, absolutely. No, thanks, Ben. It's great to be here. I think, the first time we met was, gosh, what, 2.5 years ago when I just started it at HPE.
Yeah.
And we were doing some fun prospecting efforts. That was a great training. But yeah, so everyone knows me on the podcast. My name is Alexis Coticchia. I'm a healthcare and life sciences account manager at HPE. Been here about 2.5 years, based in sunny California. So it's been a great journey so far. Not too much to complain about, but thanks for having us here, Ben.
Yeah, no, absolute pleasure. And yeah, we had some fun on that session over in the valley, didn't we? Doing all that prospecting stuff. So no, it's great to link back up with you, Alexis and Chris. Do you want to give everyone a little bit of an intro, please?
Sure. Great, Ben. Nice to, I guess officially kind of meet you. My name's Chris Platt. I am a field chief technologist at Hewlett Packard Enterprise, supporting our healthcare life sciences vertical. And in HPE's healthcare life sciences really spans a huge breadth of different type of healthcare accounts, from providers like the hospital networks to payers and insurance to med tech to life sciences and pharma. And so every day, through those different accounts that we all support, that Alexis and I and her colleagues all support, we get to really see the full spectrum of how our infrastructure and how IT is being used to advance, like what you said, Ben, one of the most important, kind of fields and that everybody touches every day.
Yeah, yeah, absolutely. Okay, thanks, Chris, and great to meet you too. So, look, yeah, let's step through the agenda today. So, we're going to cover AI in healthcare, what you guys are seeing, and then, as per the name of this podcast, really focus on the outcomes you're seeing your healthcare customers, what they're looking to achieve through adopting AI. Really keen to understand any kind of customer use cases, customer stories, and look, if you need to anonymize, because lots of these projects and programs will be in flight. So, but anything that you can share about the outcome and those use cases, I think would be really, really good for everybody listening. I do want to cover your technology. We don't go deep dive on technology. You'll be pleased to hear, but you've got some interesting relationships, and you guys got a big partnership with NVIDIA. So perhaps we can cover that, and then looking at kind of barriers to execution of projects and programs, and ultimately driving transformational outcomes in healthcare through the use of AI. So, and maybe a little bit about vision for the future and what you guys see kind of coming over the horizon there. So, right, AI in healthcare. Why is this an important market for HPE?
I'll try it and take that first. As I mentioned, right, we HPE is involved in so much of healthcare across that whole spectrum. And it makes it a very complex challenge on how does our customers support their customers. And it's highly competitive. It's a market that, for all intents and purposes, is very price competitive. And there's a lot of challenges for having, creating, a customer stickiness with the patients that are there, right? In a lot of ways, there's challenges that our customers, the hospitals, the providers are having, whether it's financial, whether it's in staffing, right? There's going to be huge staffing shortages predicted here in the coming years, whether it's cybersecurity and protecting of data, integration of data. These are all kinds of challenges that we have that then add in and to the complexity that the industry, the healthcare industry is highly regulated, right? And there's all the stipulations that require, that additional awareness across all those kind of elements that I just spoke about, security, financial, and all the rest. And so our customers really need to embrace solutions today to prepare them for that future that you talk about so that they can be more efficient, more budgetary conscious, and have that ability to still provide the patient care and the experience that's necessary for the right outcomes with the patients.
Yeah, and when you say healthcare, break it down. Obviously, you've got the hospital and clinical environment, but who are your kind of, what would be the categories within the subcategories within healthcare, Chris?
Obviously, when I think about healthcare and specifically on the provider side, I kind of break things down into four different categories. Two of them are more on the clinical side, and two of them are more on the business side of the hospital. And so if we kind of look at the clinical piece, there's the patient experience, meaning, like the bedside experience, where technology is applied specifically to the patient, right? And that could be things such as remote patient monitoring. It could be, just monitoring for safety. It could be ambient listening in examination rooms, right? These are all kind of things that are very specific to the patient itself. Then we have clinical operations, right? Running the hospital side of the business and looking at supply chains and other kind of things that are, really important for making sure that the hospital's safe, it's protected, the nurses have access to the data they need when they need it, being able to have more efficiency on the hospital floor itself, right? So we kind of have the patient side and the clinical operation side, and that's just two elements. The other side, where we're still dealing with patient data, I call front of the house, right? So admissions and records keeping of patient data and all of that, which is still in that highly regulated piece, integration with the EMR or EHR systems, the PAC systems and things like that. And then lastly, and kind of more of a horizontal approach, right? Because it would be more cross industry, is what I think of as back of the house, right? So documentation, financial information, onboard training and staffing and things like that. So it really kind of falls into those four categories in my mind. And after talking to a lot of our customers, a lot of focus groups that I do at the big conferences, it's really interesting to see where everybody is on that journey and where they're trying to find the right use for the technology in those, where based on like where the technology is today from a maturity level, right? There's still a trustworthiness and of AI at the patient side, which still requires human in the loop. And so a lot of these hospital organizations are today really looking at how can we make the best use of the technology and make it more efficient for us, right? So today, let's say if a doctor or a clinician is still necessary for approving things that the AI is recommending, is it really, creating more efficiencies? I argue that, we need to start looking at these things now because, in the future, when there is more trustworthiness, when there are more accuracy and things like that, you want to already have a reference point of your data that's being collected and used so that you can make better decisions later.
Yeah, and I guess that's important in the US market because you've got a competitive dimension to this as well, I guess, between these different institutions. So people vying for business, obviously within a certain local area. So I guess that would be one of the main differences to say in the UK with, let's say, a hospital. They're all run by the NHS. They're interested in what each other are doing, but they're not commercially competitive with one another. But your customers over there, they are large businesses at the end of the day, I guess.
100%. And you bring up a really great point. So as part of my introduction, which I didn't say, I live in outside of Philadelphia, Pennsylvania. And where I live, to your point, there's at least 5 major hospital networks that are all vying. And in a lot of ways, in central Pennsylvania, where I live, there's a confluence and in that competitive nature of these hospital networks spanning into the more rural areas, trying to grab, more patients and creating that competitive piece. And so, that the technology, as we know, can be a very competitive tool to help them create those type of experiences for the patients. giving them that competitive leg up or giving them the capability to do more, grab more area, more patients with less staff because the technology can help them, especially today when we start talking about telemedicine and remote patient monitoring and a lot more remote facilities, right, in care clinics that aren't necessarily the hospital itself, but all these outpatient type of functions that are being done in more of an urgent care kind of like model.
Yeah, so you got that kind of ROI, need for ROI. You mentioned change in demographic, meaning we've got skills shortages in the future. Interestingly, Thomas Odenwald, who I know used to work for you guys, now he's joined me on the podcast now, but he was saying in Germany, where he's from, they've got like a 270,000 worker gap in actual bodies to do jobs in public sector coming. So it's not just like, oh, we need to automate this because we want to make it more efficient. No, we need to automate it because we're not going to have the staff.
Yeah.
and you made the same point.
Yeah, we're seeing very similar numbers here, and it is a growing, huge concern. And for all of us, I mean, we all have medical needs, so I see it every day. It's really interesting to me. I see how much more I have to do today to get my son's prescription filled than I did 5 years ago, right? It's something as simple as that, right? I have to be much more involved in my own, medical care, my family's than I ever did before, because there's just not the people on the other end of the phone that can help us out.
Okay, right. So that's kind of sets the scene, and maybe Alexis bring you into this as well. So if we work back from patient outcome, because that for me is the really important thing when it comes to healthcare. Of course, it's great when the organization gets to save a bunch of money and drive efficiency, but really this is about patient outcome, which is it's just personal to all of us, isn't it? I mean, I shared on a previous episode that I created it when I just did my research on AI in healthcare. My son had his heart reconstructed when he was 9 months old at Great Ormond Street. You know what I mean?
Yeah.
I've lived and breathed the healthcare system for many, many years. But Alexis, from a patient outcome perspective, what are you guys seeing? Is there any kind of use cases that you're seeing, any kind of customer examples that are anonymized or otherwise that really you kind of stand out for you, Alexis?
Yeah, I mean, I think when you think about what AI use cases can we tie back to specific patient outcomes, some of the immediate ones have been remote patient monitoring, right? So if you can tap into some of the footage that hospital systems probably already have and are recording, how can you prevent those falls that many more times, which means you're now not having as many readmissions, right? And that will then tie back to those executive outcomes as well. But again, the patient's having a better experience, or how can you tap into some of the machines that are monitoring those vitals? Okay, something's spiking. We need to alert the nurse, right? That much quicker, that much faster. And so that's a huge use case. I think a lot of hospitals can start to wrap their head around and see the value right out the gate, because like you said, in order to get these AI initiatives actually implemented, they need to know how it's going to come back to the business. And so I think that's one that's been very, I guess, heavily accepted. We'll say that. I don't know if Chris has been working on our healthcare group for quite some time. I don't know if you have any immediate stories that you've seen when you've been on the floor of your customers.
Yeah. So a few, and it kind of spanned a couple of different areas there, right? So obviously, that's a big one, right? Using computer vision in the hospital and making efficiencies there from the patient outcome. But I've been working on a couple opportunities. They will be anonymized around things like note summarization. Big issue for as patients move around. How does a new doctor see a new patient and come up to speed right away? As we know, these doctors and these clinicians have, their schedules are back to back. And so they're walking into a room with a new patient, right? How can we use technology to take old patient notes, have them summarized very quickly so that a doctor can come in with some understanding of this new patient who he's seeing? Big project, doesn't sound that hard, but there's some complexities in there, right? And in a lot of ways, because all the systems aren't set up with the full data integration, that, I can move data easily and electronically, I might get delivered a folder full of PDFs of this patient's records, right? And maybe the patient's a child. So the parent comes in and he hands that record over, right? Scan them in, convert those, and then use natural language processing to summarize the notes so the doctor doesn't have to. Another area I've seen is how can the hospitals do better, right? So everybody's interested. I don't know, anytime I do anything. In fact, I just filled out a survey today from an MRI I had done 2 days ago. So every one of these hospitals is keenly interested in what their patients are saying about them, whether it's on social media or in surveys. So we were working on a project to do a sentiment analysis dashboard where ingesting in real time to show the dials, to show what are the patient's outcomes and in the survey saying, what are the peer-to-peer reviews saying about the people and the experiences that everybody's having working together or from the customer. The patient. I always call him customer. I should call him patient. And then as we get into more of the other side of like the more tech, the more of the medical side, genomic sequencing and looking at how we doing drug discovery, or gene typing, right? What used to take months, that used to take weeks, now can take hours. So getting to results much faster, to do medical imaging analysis, right? You talked about staffing shortages. One of the biggest areas that I've heard in staffing shortages is around radiologists and medical imaging diagnostics. And so if we can use AI to prioritize image studies for the radiologists, so the ones that have suspected things on them can be put at the top of his list so he can look at those first and prioritize the most critical elements. Those are kind of things where AI can help bring efficiency. You mentioned COVID earlier before I think we started the recording and the things that happened there. HPE was very instrumental in helping out the drug manufacturers in that vaccine research to get the COVID vaccines to market, and accelerated that through. That also showed us during COVID another huge vulnerability in healthcare, and that is the supply chain. I mentioned that earlier. So we did a lot of things to help in like how do we forecast, the supply chain, because whether it was due to something like COVID or even here in the United States, there was a major issue a year ago where the major facility that manufactured the IV fluid was destroyed in a hurricane. And all of a sudden, the IV fluid supply chain just dried up in the United States, maybe the world, I don't know, but definitely in the United States. And there was a huge rush to how do we manage and prioritize patients when our supply chain was so dependent on this one factory. So we do a lot with supply chain forecasting as well. And the list goes on and on to all kinds of other things that we could talk about pretty much forever, I guess.
Yeah, and it's an exciting list, isn't it? And a couple of things that kind of spring to mind. I mean, Alexis made the point of remote patient monitoring. Well, they're already capturing this data, right? They've got cameras everywhere. It's actually doing something much more meaningful with that data. And you made the point about readmissions, so reducing readmission rate, which I'd never actually considered that, but it makes perfect sense. And then on the clinical side, and again, drawing on my own experience, you don't necessarily want to outsource the decision. So the decision stays with the clinician. What you're looking to do is get all of the available data as efficiently as possible so the clinician can make the best possible decision per patient. And I think on average, they've got a kind of like 10 minutes per consultation, right? So that part that you were talking about, hey, could I just have an LLM just summarize this out for me? Anything you can do to make that more efficient is going to be super, super helpful. But so when we're talking about augmentation of physician and healthcare professional rather than replacement of their core, oh no, I still retain the final decision.
Yeah, I think it has to be a side-by-side, hand-in-hand kind of relationship between the medical practitioner and the tools that are presented to him to make him more efficient. I'm not a big fan of wearables, but I know so many people that wear things and have all these biometrics being collected about them. And so to this point of wearables or remote patient monitoring, to say that I'm going to send a patient home with some kind of diagnostic tool that reports back every day, right? My father used to had an AED device implanted in him, and every night when he slept, next to him, all of his cardiac tapes or strips were all sent to the doctor. So every day the doctor had new recorded data about my father. And you could use those things to make himself, like you said, more efficient. But the doctor still is the one, the clinician is still the one that has to ultimately make the decision. Our job, and one of the biggest challenges, I think it's kind of one of the next things we wanted to talk about, was like, how do I take all these silos of data from my wearable to the patient side devices, to the EHR, to the medical imaging piece? And oh, by the way, I'm getting tests done all over at this lab or this outpatient center, and pulling that all together to create that 360-degree view of the patient so that that clinician walking into that room has this data all available to him, hopefully summarized in a way that makes it easy for him to consume, so that we can then have that meaningful conversation in that 10-minute consult that I get with the clinician.
Yeah, and I think let's go there next. Is how does the technology actually work as a platform to do that? To give everybody listening or watching this on YouTube an idea of the number of data points, though, I think that's important. So with UC Davis, on their remote patient monitoring, they were getting 11,000 data points per day on each patient. Now, at 11,000 data points per day, it doesn't matter how great a doctor I am, I simply can't go through all of those data points. Bring in a wearable, your Apple or your Garmin, which is what I've got. I think that was jacking it up to like 24,000 data points per day. And then you've got the data points from Chris, you mentioned the computer vision around looking at the scan. Well, a doctor can look into your eye and look at your retina and tell certain things. The computer vision AI can look at your retina and tell you stroke risk, heart attack risk, blood pressure. It's just unbelievable what the computer vision can see that the human eye, no matter how good the doctor is, can't. And that applies to echocardiograms as well. It can just, it's unbelievable what this computer vision is capable of.
Yep. I'll take it one step further, Ben. We heard from a number of customers in their surveys of their patients and the patient experience, two very disparate complaints that most patients have. One is, and this is kind of funny. One is finding a parking spot in a medical tower, in a medical pavilion in the hospital, right? High stress situation. I'm going to get surgery. I'm with my loved one and we can't find a parking spot, right? That was one of the biggest survey complaints that we've heard, right? So parking lot management would be huge to relieve that, just a little bit of anxiety from a patient coming in for surgery. But in a post-op world, the biggest complaint that most patients have about the hospital is, I'm being told to rest, yet I keep getting bothered every hour to have my vitals checked.
Yes.
And
we call that the observations.
Yeah. And so today, now I'm dealing with companies. So I do a lot with some startups in health tech that are really looking to drive new ways, like you said, to be able to look at the data in different ways. And one of them is, and I always get this word wrong, contactless monitoring. How to
Right.
measure blood pressure, pulse rate, and breathing without actually touching the patient. And there's technologies that are coming out today. They can look at the microscopic movements of a patient sleeping and can determine, what their pulse rate and their breathing rates are just from the micro movements of the blanket hanging over them, or, is draped over them. So there's, the technology, there's so much promise for what those capabilities can do. And I'm really, to your point of like why, healthcare is so important. It just fundamentally is like, I'm so excited to see how we can apply those technologies to, let's face it, everybody in the world, right?
Yeah.
Everybody,
Yeah.
could be a patient sometime in their lives.
Yeah. No, that's some really good point, and it got me thinking. And it will probably be another conversation, which is the preventative side. How do we not have people end up in the hospital bed in the first place, right?
Yeah.
And
Yeah.
I think that's going to be fundamental. Reduce the pipeline of new customers to the hospital.
Yes. And so, I mean, I think that the whole way of like being predictive and being prescriptive to be able to see those signs and tie that all together is still very much in that infancy state, right? Because we still being able to connect those dots and start to make those correlations. It's happening, but it does become now, to the point you made and Alexis did, a huge data challenge, right? How do I break down silos? How do I compare against the right data sets to understand what is normal and what isn't, so I can make those type of decisions with the technology to be, to advance that preventative side so that I can see when things are coming, right? Even like I said, the genomic sequencing piece is so huge. Even today, like, I have personally, my wife is a cancer survivor, and being able to have the genomics to know whether she was predisposed to something, we didn't have that 10 years ago.
That's right.
Now,
Yeah.
it's almost every person can have their genomic sequence type, because the time it takes is so small compared to what it was 10 years ago to compare to what it was 20 years ago, when the Human Genome Project, first came to life. The ability to have that personal record and be able to look into that and extrapolate out certain things that you may be susceptible to is huge.
Yeah. I mean, and look, you mentioned it, and let's move on to the data, because the information is there. The AI is really, really good. How do your customers actually then enable the outcome from this kind of trove of data that they all collect?
Well, I think that's the hard part, Ben. I mean, Chris and I talk about this a lot, but it's that data problem, right? I think when you talk to a lot of people, they say, we want to do AI, we get wrapped up in the buzzword of AI, but we forget what that really means. And so if you go back to the fundamentals of analytics, I mean, it's a two-sided coin in my mind. On one end, you have all the AI machine learning, the models, algorithms that are taking that data and providing that true value and that outcome that we're, trying to get to, right? But before any of that can happen, you need all of the data. And we've talked about, okay, how much data is being created now? And you kind of mentioned it as well. Those wearable devices and the remote patient monitoring, I mean, 11,000 data points. We're just saying, at the edge, data is being created at an exponential rate, and 11,000 already sounds, astronomically high. So how do we take all of that in? We have to clean it, put it through a pipeline, train it. There's so much to do before we can even get that outcome. And I think that's one of the biggest challenges organizations are facing right now is, how do I use, what's my AI platform going to be? How can I do all of this? Because if you think about healthcare systems, a lot of them are running very, very lean. Again, it's putting their patients first. So that's where all of that revenue is going. And so they don't have a ton of expertise sometimes to do all of that data lifecycle management that has to be done beforehand. So that's a real challenge. And I think that's where companies like HPE are trying to step in and take that big lift off of their shoulders and provide technology that can do that so we can get to the outcomes faster and get them from that pilot phase to that production phase that much quicker. And it's really just like Chris said, breaking down those data silos, because a lot of organizations have data in a couple different places. So it will be, the edge, like we just talked about, right? All the wearable devices, CT scans, telehealth services, anything like that. But still a lot of their data that in their colo, their data center, or even the cloud. And so when we're thinking from an IT perspective, how can we unify all of that, simplify that so they can get back to focusing on their patients? So it's a real challenge. Absolutely.
Yeah, that's really interesting because, I hadn't actually considered the data sources. Well, and you mentioned cleaning the data because you can't do anything with the data unless you know which is the data's in this spreadsheet, this cell's filled in correctly.
Right.
And so you've got this potential absolute mess of data from all these different sources. You mentioned from the edge as well, which is, I guess this would be classed as kind of edge. So what do you guys do as HP? Do you arrive to a typical healthcare customer and they're saying, look, we want to do this, but as you say, we need to keep focused on the patient. We haven't got all the skills in-house to just suddenly spin up training models and AI stuff. How do you guys help with that, Alexis?
We have announced over the last year or so a really great partnership with NVIDIA, and we have put together an incredible turnkey solution to be able to get our customers, like I said, from pilot to production that much faster. So we've been able to kind of supplement where they might not have a ton of the data scientists or data engineers to do all of that lifecycle management through different software, and we have the hardware to support it all as well. So we're able to provide them a turnkey solution that will get them up and running really quick. So again, it's trying to take the guesswork out of all of that for them, and really show them, hey, this is the outcome you want. We can give that to you. Let us worry about, the technology stack behind it.
Yeah. So, and that makes good sense that you, and as a provider, if I'm sat there thinking, well, hey, do I need some of these NVIDIA GPUs then to do all this training and inferencing? And the answer's probably like, well, yeah, you kind of do. Well, I'm like, well, can I just put all my data up into the public cloud? Well, you can't. You can and you can't, depending on what the data is and how much that's going to
Right.
cost and all that stuff. But you're saying that your partnership with NVIDIA means I can actually get your technology with the NVIDIA GPUs pre-configured. You said it's a turnkey solution.
Yep.
How much of a turnkey solution is it arriving pre-configured? And then what does the customer then, how do they handle that new technology in their existing environment, I guess?
Yeah, I mean, of course, before even providing it, we'd have to go in and scope and size and see what the right fit would be based on the use case. But the point is it is a co-engineered solution with NVIDIA, right? We created this with them. It's tried, it's tested, we know it works. So we're trying to de-risk, right, as well. And so it comes with everything they need to get their outcome. It has the compute, the storage, the networking, the GPUs, the software layer, which is really where the magic's going to happen, right? So again, it has everything they need to do AI at scale. And that's the key, at scale, because some people are able to spin things up and do things on their own at a smaller scale. But when you talk about bringing that into these large health organizations across maybe all of their locations, and again, the more data you have, right? I mean, it grows and grows. And so being able to have us and NVIDIA as a partner to say, we can do this for you at scale. We know it works. We have the expertise to do it, I think is something that is a huge differentiator for us right now.
Yeah, and sorry, Chris, I don't want to talk over
I'm gonna
you.
say
Chris,
let me just kind of pick at that expertise piece that Alexis mentioned, right? In a lot of ways, this journey to operational AI, that's what I like to think of it as, right? Which starts out
Right.
with the data elements that leads us to an outcome that we can operationalize with AI. And that's a big part of it. But, from my experience, in all of my career, what we're talking about now becomes much more of a consultative engagement, right? There's not a single hospital, a single customer anywhere that has the same problem in the exact same way that we can do a wash, rinse, repeat. So it really needs to be a highly consultative pre-sales engagement that Alexis and I work with our customers to really understand. And the power of HPE isn't just in that we've got the AI factories and these turnkey private cloud offerings with the co-engineered solutions with NVIDIA that bring the full tech stack to bear, but we also have the bench of advisory professional services to help our customers, to your point, get that kick started so that when we land a platform there, we have the expertise to help them bring the models, bring their data, marry them together, do the analytics, and help them create that workflow that will bring value to the clinicians. So it becomes highly consultative with our best-in-class hardware and software solutions, the ones, with NVIDIA, and then also the talent that can help bring some of that expertise, that they have done before and we can augment. So as an example, I have an insurance provider that I'm working with that struggles with, this is more kind of back office kind of things. They struggle with time to support on internal support calls. So just building, a chat bot to take the top 20 use cases that they see every day and they have everything ranked, right? To take those, how can we create a virtual assistant so we can have a self-help layer before they actually have to talk to a live body on their internal support desk? That's something we've done in the past, and our advisory and professional services team can help, augment something we've done, prepare something for them, do a test with their data, and then help them deploy something out to create a value tool for their internal teams.
Yeah, and I guess there's never been, and I keep saying this, it's never been more important for a end customer to have really good, strong partners now with this AI thing. It's going to help them avoid a lot of problems that could have been foreseen. It's going to help them extract way more tangible business benefits and business outcomes from this technology. And I think on the customer side as well, that you need to be engaged with a really strong team on the customer side. So it's never been more important that the customer gets their governance right, and we have people from the clinical environment, probably the chief executive or whatever they're called in the hospital environment. It needs to have this real joined up working and co-creation, because this stuff's expensive, right? I guess you're not giving this stuff away. You know what I mean? It's not going to be. So ultimately, chief finance officer needs to say, yeah, that we'll sign off on a business case for this as well. So, and that all circles back to your point, Chris. Incredibly diligent, robust, consultative sales engagement is what's required from our side on the supply side, right?
I mean, 100%. I mean, you're taking the words right out of my mouth. I've discussed this a number of times, right? There's three key elements to a successful AI strategy, in my opinion. When I say elements, there's three key constituents at our customers that have to be involved in the project from day one. Obviously, we've got the IT administration and the team there, right? Because they're going to have to own whatever the footprint is to run these AI models. And whether that's inference at the edge or model training, right, or it's high performance compute, whatever those are, right, it can be a highly complex environment. I've got, one of my largest customers needs to be putting inference at the edge out where these devices are, because even the latency back to their data center is too much time, not even talking about the latency to the cloud, just latency on campus. So there's a whole challenge in how I manage that. Then I've got the data scientists, right? That's where the magic happens. They're going to take the business problem and turn it into an outcome with AI that can be deployed, right? So I need the data scientists and the data engineers involved early, right? To Alexis's point about, right, I need to be able to correlate my data, clean my data, prepare it, organize it, wrangle my data so that I can actually find an outcome and an insight that I can benefit from. And the person who's going to benefit is the chief medical officer, the chief nursing officer, the chief operating officer of the hospital. They've got the problem, right? They've got the staffing shortage. They've got the patient experience. They've got the safety, whatever it is that they need to do. They have the challenge, and they're the one that has to allocate the budget. And without all three of them working on the project or having an understanding early on, we probably won't have a successful AI deployment if we don't have buy-in at those three levels from the beginning.
Yeah, so the number of different customer stakeholders has increased. If we think about this from a kind of classic kind of account management kind of sales perspective, the problems, you need to have a much more detailed understanding of the problem statement. And your point, Chris, is a good one. It might be something really straightforward like the car parking. Anybody who's listening to this who's in B2B sales, with account management, go see the car park. Literally go get in your car, get on the train, whatever, go to the car park and sit. Go to speak to the chief nursing officer, go ask to see the clinical environment. You've got to be able to understand where the patients are, what their experience is, and hey, we called that experiential empathy on the program that I ran for you guys, Alexis. Literally go there and experience it, because if you can't see it, how can you really understand the complexity and the nuances of that problem for that particular healthcare customer?
Yeah, I think you bring up some great points, and I'll take it maybe a little step further, maybe in a different direction. When we want to kind of rewind back, how do I have a successful AI strategy? We need to have the right data too. And this becomes a real big issue. I work with a lot of startups that are understanding that to get the right patient outcomes with AI, we need to be training them with the right data. And so there's a lot of underserved demographics that we're just kind of taking a generalized data set and applying it to, some very specific, things, whether it's where you live, your ethnicity, male, female, predisposed to other elements. I can't write them off the top of my head. So I'm working with a number of startups that are looking to collect a very prescriptive data set so that we can apply that to train the models specific to a very specific demographic, and use that so we have the right outcomes coming out of our AI versus just lumping everybody together and making certain baseline assumptions, which is where this is this huge trajectory on the hype curve of AI that we're on going up. Is now that we know the power of doing, generative AI and large language models, how do I give it the right data, the very specific data, so I get my outcomes the way they should be versus just making certain assumptions about it. And that's where I think the horizon that is very bright, because we're going to get those data sets very scrubbed and very prescriptive and be able to get the accuracy of the AI modeling proper, correct, so that then, we'll have those better outcomes and be able to be then, to your point, Ben, more preventative in the future, because I'll have better data sets about that.
Yeah, that's that. Yeah, absolutely. It's almost going to be that natural flow, isn't it? That we're
Yeah.
going to solve for the problem probably at the clinical end today and make that. It does need some efficiencies because this stuff has got to be paid for, and then that's going to work back to being then much more obvious what needed to happen for on the preventative side. But it's almost personalized preventative. So how do we stop Ben getting readmitted? I think that's a
Yep.
really
Yep.
important point because if you looked at like the pie chart of the costs, and maybe it's like Pareto law or whatever, it's 20% of the populace driving 80% of the demand on the care environment. No, it's really interesting. And what it isn't is it never more so has it not been a technology kind of sale of, oh yeah, we just spec'd up some servers and some network, and this is, if you're approaching this market like that, then just expect to not be successful in this new world. And I think that's a really, it's not just like it's more important to be highly consultative and to really research and know your stuff. No, it's critical now
Yeah.
because you can't.
You can't mess
this
it
is-
up.
It's not
Yeah.
how many of these things do you want, Mr. or Mrs. IT Ops? You know,
Right.
you gotta really
Right.
care. I think you gotta really care. What's you're great as consultative seller, Alexis. What's your perspective on how that role's changed? And I'm just keeping an eye on. We've got about 5 minutes to run, but that'd be really interesting.
Yeah, no, I think you're 100% right, Ben. I mean, when you're going into healthcare, you have to think about if, as a consultative seller, you're looking at who am I selling to? What do they care about? Right? Why would they want this? It's because they want the patient to have a better experience. And so, from a seller perspective, you're really looking to understand from the key stakeholders of the business, what are you trying to drive here? What are the initiatives? Where's your future state that you want to get to? How much greater would it be if you could do X, Y, and Z, right? It's really, it sounds like a broken record, but it's those outcomes. You have to align to the outcomes and align to what's important to the business. And in the case of healthcare, it's patient experience, right? And
Mm.
so we have to go in with that kind of mindset and we have to ask the right questions. We need to know enough about our customer that we can speak intelligently about their business. And so I know we have the team on our end who can help them get there. We just need to have that kind of discussion with them and then see where we go next. And there's a lot of, with these big healthcare companies, there's a lot of road mapping, right? It's okay, you're here today, you'd like to be here in this many months, this year, right? Let's plan for that so that we're making sure we're not helping you solve your problem today, but we're making sure it's future proof for what's to come. I think that's really, really important. And that takes you from just a transactional seller to, again, that consultative seller.
Yeah, that future proofs that, and Chris, I'll come to you, but that future proofs even more important now that NVIDIA will every 2-3 years are going to bring out the next generation of GPUs. So it's like, what do we do this all again in 3 years? And if I was on the customer side, that future proof would be very important to me. Chris, sorry, you were going to come in there.
That's okay. It's I'll argue it's maybe down to 6 months to a year before the next revision.
Yeah, probably.
Comes out. So the pace of change is huge. And I was talking to Alexis as we were prepping for this last night. I would not want to be one of our customers because it is so hard and difficult sometimes to just, when do you jump in? You know, I remember back when I first bought my first large format TV. First of all, how much money I spent on it and how big it was, knowing that 3 months from now, there'll be a bigger one cheaper. When do you make that step in? And it is a huge challenge. And in a lot of ways, what we're doing with private cloud AI with our turnkey solution is giving flexibility to be able to incorporate next generation technology into an existing footprint today so that we have the right refresh cycles and we can meet our customers where they are as the technology provides itself in. But I'll tell you, as we kind of wrap up, I think one of the most important things for us as HPE, as sellers in this place, is creating that partnership on that pre-sales side. It's paramount to the success, right? We don't want to be transactional. We can't be transactional in these. These are long sales cycles, and there's a lot of collaboration that has to go on back and forth between the customer and their needs and their capabilities and what we can bring in and augment. And my best experiences are when we become that, and I hate using some of the cliches, but that business planning partner or that trusted advisor that is strategic to their end game and their goals. And we become part of their embodiment, and we can help them there from more of a partnership standpoint, because, we do have the pressure to deliver, but this, like I said, the cycles are long and there's a lot of steps in them to make sure that we get to a successful endpoint with the customer.
Yeah, look, you made some very good points, Chris, and we'll finish up now. But I think, Alexis, you use the term to be able to go to your customer or prospective customer and have an intelligent conversation. Yeah, it means you've got to be researched. It means you've got to have guys like Chris around who kind of understand the clinical environment, and you guys need to have the right partnerships. And it never more so if we all needed to work together. So it's great learning more about what you guys are doing. Alexis, where do people find yourself and Chris? And if they want to learn a little bit more, how do they go about that?
Yeah, absolutely. So Chris and I actually just launched a new community called Unconventional Tales. And so this is our LinkedIn community. And I'm sure, Ben, we can share it, with the viewers of the podcast. Chris and I have been working together, and we thought, how do we bring these people together? Like you're saying, right? We need to work together. We need to hear from each other's customers, need to hear from other healthcare companies, right? We all need to be collaborating because we're in this new space, this new frontier, if you want to call it. So our LinkedIn community is really a space where people should feel comfortable sharing ideas and thoughts about what they're doing today, what they're seeing. We throw in our different perspectives, and I think a lot of people can learn from it. So we'll have to share that out with the viewers, but please feel free to join our community. We would love to have you.
Awesome. Okay, we will drop the links to the LinkedIn community into the show notes, and yours and Chris's LinkedIn connection links as well. So yeah, everyone go hook up with Alexis and Chris and just learn a ton about healthcare outcomes. But been brilliant talking to you guys today. Thanks so much for coming on. I've learned a lot. So we'll no doubt catch up soon. Hey.
Awesome. Thanks so much, Ben.
All right.
Thanks so much,
you.
Ben.
Thank you. Thanks, guys. Bye bye.